Welcome back to the show, Therapy Unzipped. I'm here with my friend Brett.
Hello, hello, hello.
Once again, my name is Tom, and I had a pretty intense week, although I don't know why it was intense. Like, I go back through the week and analyze day to day and try to think what was so, not that it was overwhelming, just intense. And there was nothing really to speak of. I just have that feeling. So sometimes you just, maybe you're not fully on. Maybe it's a little lack of sleep. I worked a lot this last weekend instead of resting like I usually do or have been doing, have been implementing since I needed to correct myself. And this last weekend I was really productive, which I like to be. It makes me feel good. But I think I'm just still recovering from that and not having the requisite rest, and then going into a full week with clients. And it's the summertime in Florida. It's hot, like hot as balls, and it's gonna get even hotter.
Yeah.
Just the start, man.
No, it's going to get cooler by like 3 degrees. So we'll go from like 97 to 94, Tom.
Yeah.
Come on.
Yeah.
I had an intense week as well, but I know why my weeks are intense. I'm selling a house and packing and buying a house and moving and doing all kinds of stuff like that. So
Yeah.
it makes for an intense kind of environment where lots of lists, lots of to-dos, lots of whatever. But when we're feeling a little bit off, when we, like you were a little bit off this week, been a little bit off this week, we always like look for the reason, like why.
Yeah.
And sometimes it just is. I mean, your mood goes up and down, right? And I, working in emergency psychiatric and medical services for a great deal of my career, understand that we are influenced by lunar tides, by full moon, by just, different times of the year, different times of the week, different times of the month. There's a kind of a collective up and down, right? So, sometimes it just is. You don't have to find a reason for everything all the time. Why am I crabby? Why am I this? Why am I that? Sometimes you just are.
I always love that phrase, a minor inconvenience, that you
Minor
coined.
inconvenience.
And I go back to that religiously because there are so many things that I blow out of proportion. And if I can remind myself, dude, it's just a minor inconvenience.
Right.
And I was thinking about trauma because we've been talking about trauma a lot this week. And I mean, maybe that'll be something we talk about on the show. The things that happened that were traumatic for you, not a minor inconvenience,
No.
a huge ordeal, right? When they happened. And I know that you're going to experience triggers related to that. And you're going to feel like you're back in that situation. You're going to have flashbacks. You're going to have nightmares. You're going to avoid certain circumstances or environments or types of people that may trigger that, flooding of emotions and negative thoughts and in response to that trauma. But really, when those do occur, they are just minor inconveniences themselves. It's not like you're re-experiencing the trauma again.
Right.
Now, if you are in a situation where it's another trauma, that's similar to that, okay, that's a major thing to have to deal with. But most often, like 90% of the time, that's an arbitrary number. I'm not basing that on anything, but most of the time.
Most of the time.
You're not experiencing anything that is horrendous, that's earth-shattering. It's just these little triggering things, and you have power over those. You have agency over it. You don't have to allow yourself to be re-traumatized in that situation. If you are triggered, you got to go back to, I'm okay, I'm safe, this isn't the end of the world, this isn't trauma, these people are maybe not trauma-informed. Because there's a lot of people that are not trauma informed that, they're like everything is okay. Why are you like in this uproar? And you're like, well, you don't understand what happened to me, like, well, bro, when are you going to be done healing? I know that's, as a therapist, that's kind of crappy of me to say, like, when are you going to be done healing? I mean, we're helping people heal and overcome and work through and carve out better lives, even though they've had this trauma and they may be triggered from time. I get triggered from time to time. We've all experienced trauma. It's outside of our ability to cope. We lack the internal and external resources to deal with whatever it is that's happening. But, like, we don't have to always cling to my trauma. And this was my experience, and I have to heal from this, because we get in this mindset of external locus of control where these things are just happening to me and I'm the victim of this.
Right.
And I want to try to move my clients and those who are watching out of that victim mindset.
Mm-hmm. People become comfortable being a victim. It's my role.
Yeah.
Who am I going to be if I'm not a victim? And I'm not making light of victimhood. I mean, certainly, traumatic events are horrible experiences.
Right, not minimizing those things at all.
Not at all. But so people throw around that word trauma all the time. So what is trauma? I mean, I think everybody may have a different definition. Maybe people have a different understanding.
Yeah.
Some people need to or think that this trauma is this huge ordeal, like a car accident or a terrorist attack or a sexual assault or a robbery or something like that. And those are traumatic events.
Yeah.
But there are other things can be traumatic events.
Mm-hmm.
Being slightly bullied,
Sure.
Being ignored, being from your friend group, having some conflictual relationships. I mean, some of those things. And what is traumatic for one person is not traumatic for other people. Traumas are very person-centered, right? There are people that can live through a car accident and have no issues, no problems, no nothing.
Yeah.
And there are other people that's a significant traumatic event for them. And it's the same car accident. It's just how your brain processes that information at the time. So my simple little definition of trauma is an event that your brain can't comprehend, can't make sense of, right? And it does weird things called stress reactions to try to resolve what that trauma is. Okay, so let me expand upon that. So let's just use the example of a car accident, right? Somebody gets in a car accident, I'm safe, no injury, I'm fine, I walk away. Another person's in the same car accident, but their brain can't make sense of it. I'm not safe, right? What happened here? This shouldn't have happened. So I'm gonna relive the crash and keep hearing the same metal crinkle over and over again. I could have difficulty concentrating. I could be irritable, right? Just my mood is crappy and I'm irritable. I may have trouble sleeping. I may have nightmares. I may have flashbacks where just the whole scene pops up in my brain.
Right.
Those are called stress reactions to trauma, right? So those are normal. Those are supposed to happen, right? When I say that to people are like, whoa, you can't do that, that's crazy. That's what's supposed to happen. That's your brain's way of trying to make sense out of something that it doesn't understand. And so when those things happen and you're having stress reactions to trauma is when you need to be very kind to yourself, right? Getting good sleep, slowing your schedule down a little bit, not drinking alcohol, because alcohol interferes with the way that your brain processes information and it interferes with sleep. Not smoking weed, not drinking alcohol. So just taking it real easy, taking it slow, being very kind to yourself. So what happens is your brain will try to make sense of it, and those stress reactions to trauma will diminish in intensity and frequency over time.
Right.
Right? And that way is your brain's healing from that trauma.
Yeah.
If you're still having those stress reactions 6 months after the traumatic event, that is the official diagnosis of post-traumatic stress disorder. And that's what we don't want to happen.
Right.
Because your brain still hasn't made sense of made sense to that trauma, and you're still having stress reactions.
Because it's too much. I'd be overwhelmed. Our friend Amanda's here. Hey, Amanda.
Hello, Amanda.
She had a few comments. Let's dive into it. One, there isn't a limit to the amount of trauma a person can experience.
Nope.
Totally not. Not at all. And it's crazy how some people may be traumatized 1 or 2 times over the course of their life. That could be significant enough to put them in a place where they have this negative outlook on the world and the world around them. Other people can be traumatized left and right, seemingly, and still be okay. Then that goes to our other comment. Not everyone who experiences trauma is a victim or presents themselves as a victim.
Absolutely.
Yeah, correct. Totally not. And it's based on your own personality, based on your upbringing, based on your environment, based on protective factors,
Right.
based on whether or not you cling to the internal versus external locus of control. You know, do I make things happen or do things happen to me? Those people who are more internally, motivated, and their control is I make things happen, they don't present themselves as a victim. They still experience trauma and they still have to deal with it and cope with it.
So that concept of how well do we manage traumatic events or trauma, it boils down to, as we've discussed before, the concept of resiliency, right? So
Your ability to bounce back.
your ability to manage the adversities and traumas that come at you in your life. And so some part of resiliency is genetic, right? Some people are just more genetically resistant or resilient than other people, right? So that's the concept of the dandelion and the orchid, right? The dandelion grows in the crack of a sidewalk, no water, sun beating down on it all day, and it does just fine. It's a very resilient plant.
Oh, yeah.
Or weed.
An orchid
is
not so much.
You look at it wrong, and an orchid falls apart.
Right.
So so are we more dandelion or are we more orchid in our genetic makeup? And then, as we talked about with your top 5, right, your 5 basic things, the way that you live your life and you manage your health makes you more or less resilient, right? So getting good sleep, exercise, following some decent nutrition, hydration, and some, exercise. So those things will make you, and following a schedule, I'm sorry. Those things will make you more resilient and will add to whatever genetic resiliency that you were born with.
Amanda also commented, you can't put the healing of trauma on a schedule.
No.
Yeah, no, of course not. I mean, that would be silly to think that, okay, you come to 3 sessions and then you're healed, poof, smack you on the forehead. That's it.
If any therapist promises you they'll resolve your trauma in 3 sessions, run away.
No. And I remember telling one client in particular that trauma is, I can't remember the exact term. I didn't say forever, but that was sort of the concept. Like, you have this thing and it's always going to be present. We can't take away what happened. Like, you're going to be triggered at some point in the future. It could even be like 10, 20 years where you're not triggered, but then all of a sudden something comes up and you're flooded with emotions, like as if the thing just happened. But it's short duration. It's only going to last, 5 minutes, let's say, something like that. A trauma that happened 20 years ago. For most people, especially people who have done some serious healing work on that particular trauma, it's going to be infrequent, and the duration is not going to be as long, for the most part. So yeah.
And I'm sorry. Go ahead.
Yeah, I mean, there's not a schedule on the healing. Everybody heals in their own kind of time. Sometimes without you even doing anything about it, naturally your brain comes to terms with it and reconciles it. And you heal from that.
The other thing that I've seen is people have stuffed their trauma, right? And, they've been traumatized at some point as a kid or a young adult, and then they move on to their careers and they move on and have families and they're so busy with their careers and their families and raising kids and running to the soccer game and the blah, 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 blah. They just don't have time for it. And all of a sudden the kids are going off to college. Your career slows down a little bit, and it's like now your brain has time to, and all of a sudden this stuff comes up for people at it, or they retire. Like when kids move out of the house, when you become an empty nester, when people retire, and it's funny because I'm getting towards that age and I'm more aware of this stuff now, but people come and like, my brain has time now. Why am I thinking of this crap that happened to me when I was 20?
Right.
It's like, well,
because you stuffed it down and didn't resolve it and didn't want to look at it.
Right. You didn't have time for it back then.
Right.
You kind of managed somehow, some way you managed it. But now, your brain is like, we got to get this resolved. Well, so we're going to percolate this thing up front.
Right. I remember that quote, if you don't have time to do it right the first time, when do you have time to fix it later on?
Right.
We can convince ourselves that we don't have time for whatever. Remember those old commercials? I can't remember what the medication was for, but it was like when you haven't got time for the pain. Like, but who does have time for the pain? Nobody has time for pain. Nobody has time for trauma or the healing of said trauma. But that's something that you have to carve out time to do. If you get sick, you have no choice but to call out from work. You have no choice but to stay home and stay in bed and heal and recover.
Yeah.
And just like you heal from an injury, a physical injury, or a sickness, you heal from trauma in similar types of ways. If you carve out time and space to go through it, then it's not going to be as long lasting. If you don't take the proper medication or antibiotics or get the proper amount of rest and hydrate yourself, it's going to, your sickness, your physical illness, flu, what have you, is going to last longer. But if you do the proper steps, and why is it that we do the proper steps when we are sick, physically sick, but we don't do it when we're mentally or emotionally sick or disturbed or troubled or traumatized or whatever?
Lots of reasons for that. The stigma.
Yeah.
The stigma is the big one. We don't understand it, right? We get the concept of I have the flu. We understand that concept. We don't understand the concept of depression or trauma or anxiety. Those things are, we understand, we could, we can make a definition for it, but we don't understand how it is, why it is, and how to resolve it. So if I don't understand it, how many times have you, like, okay, you and I do the puzzles every morning, right? How many times have we tried the puzzle and when that thing doesn't go, we just ignore it, right? I'll do it tomorrow.
Yeah. I think I need some more coffee before I have to tackle this connections one.
Yeah. But so when we don't have an easy answer or understand it, we just pass it over.
I think you're right. Well, I know you're right. Regarding the stigma attached to it, any type of mental illness. And I like that the stigma is becoming a little bit less, but there's still a pretty heavy duty stigma related to mental health. You could call in sick from work and say, I've got COVID. And they're like, oh, okay, stay home, do whatever you need to do. Like, it sucks, we're going to be short staffed, but all right, we'll deal with it. But if you call in to work and say, oh, you know what, I'm depressed today, I'm going to take a mental health day. It's like,
what?
Should we have this person? Should we fire this person? Like, we need to keep a list of their tardiness just so we can have a, we're not firing them because of mental health issues. It was actually, you were tardy, 3 days, you were 30 seconds late, times 3. Therefore, fired.
I joined a new company this year, and I was impressed that they have mental health days.
Right.
I think that's cool.
I love that they have that, because I think that is so needed. Like somebody who is diabetic, somebody who has the flu, so all these different ailments are like, oh, okay, do whatever you need to do. Do you need like a piece of fruit? Do you need some frosting? Like if your blood sugar is really low, do you need some insulin? Do you need a couple of sick days because you got COVID? You got to stay away so that we don't get it. And we move mountains to help the person. But if somebody says, oh, I'm really anxious over this thing and I'm having a panic attack, or I'm depressed, or something, a customer traumatized me or something, or reminded me of stepdad or something, whatever it is, and I just can't do today, it's seen as a weakness.
And I think you're right. I think we're getting better, but we still have a long way to go.
A long, long way to go.
That's why we keep talking about it.
Yeah.
Because the world listens to us, Tom.
Well, I mean,
when Tom and Brett talk, people listen.
People listen. We are not so deluded to
what
think
was that? E.F. Hutton? When E.F. Hutton talks, people listen.
We're talking about you today.
Yeah.
But seriously, a lot of people experience these things, these ailments, anxiety, depression, and sadness. These are just like emotional states, of course, in the severity where it impairs your ability to function. That's when we consider diagnoses. But you and I do not like slapping the labels, the diagnosis on people. We like treating the symptoms and the person in the environment.
Right.
not just what's going on between the ears.
Yeah, you're right. I mean, the only reason diagnoses was created, like the DSM-5, whatever. It's 5 TR? We're just in a 5 right now?
Something like that. Do we have the TR? I remember the 4 TR. Oh, whatever.
I don't pay attention to crap. But anyway, the reason we have a book about diagnoses and all the symptoms that go with diagnoses is for billing.
Yeah.
And it's for billing, number one. That's why it was created. But the other reason is so that people like us have a common language. So when we're sharing or transferring a patient or something else, I can say, bipolar with psychotic features, and you know exactly what I'm talking about. I could say 5 words and you know exactly what I'm talking about instead of giving you a whole litany of things. So it's for professionals to have a common language and for billing purposes. Otherwise, it doesn't mean anything. When people come to me and say, so what's my diagnosis, doc? Which I'm not a doctor, but what's my diagnosis? I'm like, tell me why that's important to you.
Yeah.
So you can go home and Google it to death and learn all kinds of good information, some bad information. What does that mean to you?
Yeah.
So, because you're going to get just as much garbage information as you're going to get good information.
Go to any clinician and say borderline and watch their face.
There's therapist face. But what does that mean? It doesn't mean anything except on how we're going to go look at the world.
I like how we were shifting the language regarding mental health in an attempt to break the stigma as well. But talking about how this isn't, how did it go? This is a person who is struggling with or who has bipolar or depression, but it's not them, like separating the label from them. Like they happen to have that, but it's not who they are, instead of this is a depressed person.
Or an autistic person, or we don't say that somebody's a cancer or somebody,
They have cancer.
They have cancer. I live with bipolar disorder. I live with trauma.
PTSD.
I live with PTSD.
Right. Not, well, that's just a traumatized person, or that's an autistic person, or that's whatever.
I am not my diagnoses.
So if we can change the language regarding that, we can change our own language when we're facing our day-to-day lives and we are triggered and a trauma from the past comes up. If we can change the language, change our thought processes, this is how we heal and then eventually become healed through it. This is just a minor inconvenience right now. I'm not back in that place. I'm not overseas in combat. I'm not back with, stepdad or whoever. I'm sorry to harp on stepdad here.
There's a lot of great stepdads out there.
Right. But I'm not back in that place, And if you are dealing with something significant right now in your life that is a major struggle or an inconvenience, please reach out to get as much help and support as you can. I know that there's been several clients whom I've had who are dealing right now with significant issues in their lives, physical, emotional, mental, and they've reached out to help, not only to me, but other physicians, psychiatrists, medical doctors for other ailments, and they're still struggling. Like, they have seen a lack of help and support from the community, where a lot of those physical ailments even get trivialized and linked as, well, there's a mental illness, you need to just go see a therapist.
Right.
And those people are seeing therapists. Right. And they're working on trauma, but then day in and day out, re-traumatized with it. And then so there's a lack of faith in the mental health community, in Western medicine.
Well, there is no doubt that the healthcare system in the United States, in my opinion, is so far broken.
Yeah.
It's so disjointed. It is a system of curing as opposed to avoiding, right? So we're all about, because doctors, health systems, hospitals, they get paid to fix something, not to prevent it from happening.
Right.
Right? So think about the economic, and I'm a finance guy. So I'm always about follow the money, right? How do doctors get paid? By visits and by them prescribing stuff for you
Yeah.
and by performing procedures on you, right? So if you go to the doctor and you know, they've got to do their billings. They've got to get paid.
Right.
So they're getting paid to do things. And it's so disjointed. One doesn't talk to the next. They don't. There is not
Right.
a coordinated kind of care model in this country, and it's all about money. So my personal opinion is you need to take the profit out of healthcare and create a system that works just as much on prevention as it does on procedures, right? So I'm going to work twice as hard to keep you healthy, help you keep yourself healthy, and then if you become unhealthy, then help you on the back end.
I would really like to see that change. I like the concept when we would do treatment teams, when we get together, we'd have the therapist, social worker, and the nurse, floor staff that was monitoring, the patients, and the psychiatrist, physician together, maybe even an administrator in there. And we'd talk about specific patients and what do they need? How can we all pool our resources? And through your set of lenses, what are you seeing? And it may be different than what the other person is seeing based on what's in their toolboxes.
Right.
So you go to a specialist physician who has a screwdriver and they're looking for the certain screw that they can tweak. And when they can't find that screw, they're like, oh, well, I got to refer you to somebody else. But there's never a coordination. There's never a treatment team, in a sense, of talking about, well, we can't work on things from our angle because we're not seeing the screws to screw. But, what are you seeing? And here's what it looks like from my set of lenses. What do you see? You treat the person. I wish we could figure out a way to fix that.
So healthcare, is trying to advance in a very, very slow fashion. It needs to go in a much faster way. But, there's three types of
medical doctors are fixing things.
So you have medical care, right? So you go to a physician, you go to a specialist, you go to a psychiatrist, you go to a neurologist, you go to an orthopedic guy, whatever. So there's care, right? Then there's co-located care, which tries to make it easier on people, right? So you have these specialty physician practices where you can see your primary care and your orthopedic guy and your neurologist all in the same building, right? I mean, that's great. It makes it convenient, but they don't really talk to each other. But they're just co-located. And then you have coordinated care where you have all your specialists in the same building and they're sharing the same medical record. And they're all talking to each other. So the neurologist is talking to the primary care physician who's talking to the orthopedic guy, and they're coordinating your care. That's how it really needs to work because we are not cars, right? We're not, all of our systems work together. So the guy that works on your brain needs to talk to the guy that's working on your hips, who needs to talk to the guy that's working on your blood pressure, who needs to talk to the guy that's working on your ankle.
Right.
They're all coordinated. They all work together here. Your brain and your body are, your physical health influences your mental health influences your physical health, right? 35% of post-interventional cardiac patients will have a major depressive disorder. That's significant. 11% of delivering moms will have a postpartum depression episode. So our bodies are connected to our mental health.
Right.
And the physicians know this, and they need to be working together to coordinate. So when you have a post-interventional cardiac, you have a heart attack, you have a stent, you have a whatever, why are they not giving you depression screenings on the spot?
Right.
Why are they not following up with a social worker, following up with you at 7, 10, and 21 days? I mean, it's just, that is what's called coordinated care. We know these things, but dare I say, follow the money, you don't get paid for that.
That's the thing. I don't get paid for it.
Yeah,
so if you spend time with patient and coordinate care, that's a lot of resources. Then you're not getting any more money for that.
Right.
Versus, that means I can only see 5 people per day. I don't know, arbitrary, 5 people per day. When if I can see 10 people per day or 15 people per day, then I get that much more money.
Right.
You know, not that it's always driven by money, but you know, like I can see more people, help more people, whatever. But you don't get to spend the time with that person and really care for what's going on. Imagine if you took your car in to the mechanic and they're like, "Oh, this is an exhaust problem. You've got to take it, you know, up the street. You know, here's 3 referrals for you. You know, you got to schedule an appointment to go fix that, and then come back here, and then we can work on your engine, whatever."
Right. I'll change your headlights, but you got to go somebody else for a transmission.
That would be absurd.
Yeah, or an exhaust, or tires, or
Right.
So yeah, healthcare is broken, but we're doing the best we can.
But it can be traumatizing.
And there are, you know, some of the things that I described. There are certain sectors that are moving in that direction, DRGs and all kinds of movements in that direction. But we just need to accelerate this process, and it's never going to happen until you take the profit out of healthcare.
Right.
I'm not a communist. I'm not a socialist. I'm not an anyist. But you know,
me neither.
The Geneva Convention in 1941, I think it was, decreed that basic health care was a human right. Right? Every other developed country in the world provides basic health care for its citizens through their tax dollars, except the United States.
Except us.
And we have for the money, we spend twice as much as the next country on healthcare per citizen, and our outcomes are horrendous.
Yeah.
We are like ranked 21 in child mortality. We are
right.
Our health outcomes are terrible.
Right.
So put the pieces together here, people.
We got to tighten up.
Yeah, time when we rule the world.
Right. Aren't they listening to us?
Why?
They're supposed to be listening to us.
They should listen to us.
So anyway, we're going into the weekend. I hope you had a nice Memorial Day weekend, you guys out there. You know, not, of course, Happy Memorial Day. We got to remind ourselves what the purpose of that particular day was. But it's funny how we get in the habit of just these pleasantries and niceties. We don't even realize what we're saying. Happy Memorial Day, you know. Like,
day to remember everyone that gave their life for this country.
Right, you know. So I guess a day to honor them, to those who did not come back.
Right.
You know, they didn't ask for that, but, you know, paid the ultimate price. But how we just get into these autopilot modes, you know. Remember, hey, how you doing? Great, how are you doing? Great, how you doing? Like, wait a minute, I already asked that. Just these pleasantries, day-to-day things, and there's a disingenuousness about it. It's just not. We're just focused on our own, living our own lives, and focused on our own TikTok, whatever counts, what they're showing us based on what we've clicked on, and I don't know. I guess what I'm driving at is I want there to be more of a community feel. I want there to be more help and support, you know. I don't know.
The country's moving, our society is moving in a direction. We are living in bigger houses than we've ever lived in our life, in the history of the world, with fewer people.
Yeah.
Right? We are less connected now. We are connected for the first time internationally. We can pick up a phone, we can get on Zoom and talk with people on the other side of the world in a second, right? But we're lonely and we're as disconnected as we've ever been.
Right. And I guess that's the trend that we've been seeing, and that's something that I'd like to. I feel like that's where we actually have some influence, is trying to change that, to be more connected to one another.
Yeah.
So anyway, we're starting to do that through our online community of Top Sand, to build a community. And even though it, in essence, will be a good thing, it hasn't really morphed into anything spectacular yet. But I think the concept is solid, and I'm really passionate about that, of building a community of people helping one another to be more genuine, to be more their authentic selves, and to be okay with not being okay and expressing that to other people
Right.
and having people want to help and support you instead of putting you down and making you feel weak or inferior or like there's something wrong with you. Because if they're saying that and they're bullying you in regards to that, it means that they have a deep insecurity about themselves that they don't want to come to light. So we got to put the focus on you instead.
Right.
But I want to change that. I want to have a society or community of people that are helping and supporting. I hate when there's a huge, countrywide, nationwide tragedy like 9/11 or like the pandemic, when you finally see people like unite and work together and help each other out. I want that to always exist without having huge tragedies.
Yeah, for sure.
So anyway,
Have a good weekend.
you do the same. Enjoy. I'm definitely going to take some time to rest this weekend.
Good for you. This is not going to be a restful weekend for me.
No, I know.
That's all right. I got a few busy weeks.
That's okay. You've got through worse.
It's a minor inconvenience.
It's a minor inconvenience. It's a minor incontinence.
Wait,
I got to go check. All right.
All right.
Stay tuned for next week. Thanks again, Brad.
Thank you, Tom.
See you soon.
All right.
See you guys out there. I wonder what that pop-up was.
I don't know.
All right. Good show.
Community guidelines.
Oh, baby. Did I curse? We're talking about healthcare.
All right.
Thank you guys for being here. Oh, age restricted. Maybe we said something. See ya.